Good morning to all. I'm glad to be able to participate actively to this annual ICCP Congress. Thanks to the organization. My conflict of interest disclosure is the following. I'm an employee of ProCare Siberia, which sponsors this clinical trial, and I'm a shareholder of the company. So Papillocare is a vaginal gel approved in Europe with the indication of reepithelialization for the cervical transformation zone for the prevention and coadjuvant treatment of HPV-induced lesions. This medical device is not yet approved by the FDA. Papillocare is a patented multi-ingredient vaginal gel, which includes Coriolus versicolor and other active ingredients. It is 100% non-hormonal. Concern about the evolution of HPV-dependent low-grade cervical lesion in real-life condition, we carried out a clinical study to be able to evaluate the efficacy of Papillocare on repairing this kind of lesion and clearing HPV in real-life practice. Here we present an interim analysis of an observational, multi-center, prospective, one-cohort study called the Papillops study. The study is currently ongoing and recruiting 300 vaccinated or not HPV-positive women aged above 25 years old with pap smear result of ascus or LSIL and concordant colposcopy during routine clinical visit in Spain. We choose not to perform a biopsy to corroborate the result of the pap smear in order to avoid the healing process promoted by the wound and to clearly see the real efficacy of the gel. Instead, we kept doing colposcopy to ensure concordance between cytology and colposcopy. This is the protocol of the study. Patients were treated with Papillocare 1 cannula per day for 21 days the first month and 1 cannula every other day for 5 months. The most innovative aspect of this study was that after the initial 6 months treatment period, patients with alterated cytology and HPV persistency are treated for a 6 months treatment extension period with the same dosage. The interim analysis result of patients with normal pap smear and concordant colposcopy, which was the primary endpoint, and patients with HPV clearance at 6 and 12 months are presented here. As you can see in these graphs, at 6 months, 66% of patients, meaning 64 patients out of 97, had negative pap smear and concordant colposcopy. On the other hand, HPV clearance was observed in 63% of patients, that is to say 59 patients out of 93. Data of 22 patients included in the 6 months treatment extension period are also available. At 12 months, 91% of the patients, 20 out of 22, had negative pap smear and concordant colposcopy, and HPV clearance was also observed in 92% of the patients, meaning 18 out of 22. So we can conclude by this interim analysis that papillocare has shown a notable effect in both repairing HPV-dependent low-grade cervical lesions and clearing HPV in real-life conditions. Therapeutic objectives can be obtained after a 6 months treatment period in most of the patients, achieving 91% of the patient, extending the treatment to 12 months. Thank you for your attention. Here are my contact details for any further information about the papillop study that I will be happy to provide. Thank you very much.